Hello, Namaskar, welcome to Apollo 24/7's Health Hour. Health Hour is a show which is brought to you by Apollo 24/7, where we bring you Apollo's expert doctors to the live show. On this live show, you can join us on YouTube chat box and you can type a query. I shall place it before the expert to get you a solution and an answer. On the show, we do have a quiz coming up, health quiz towards the end of the show. I'm going to ask you three simple questions and you can win prizes from Apollo 24/7 too. Also on the show, we are giving away discount vouchers that you can use on Apollo 24/7. Download the app and use the vouchers as well. चलिए आज का टॉपिक हम लोग बात करते हैं. Today we are going to talk about how to manage thyroid disorders. आप हाइपर बोलिए, हाइपोथायरॉयडिज्म बोलिए या कुछ और थायराइड डिसऑर्डर बोलिए. We are going to take up all your questions shortly. Dr. Mithun Bhartia, endocrinologist from Apollo Hospitals, GS Road, Guwahati, is going to join us in a very short while. He has experience more than 12 years and he can be consulted for diabetes, thyroid and other sexual problems as well. So professional highlights इनके हैं कि MRCP UK से है, MRCGP UK and FECSM Amsterdam से कर चुके हैं, CCT endocrinology है इनका and National Technology Task Force member Sir RSSDI के भी है and lead of sexual medicine subgroup of Diabetes India भी है. And Sir has been awarded quite many times with Rising Star Diabetes UK and also Rising Star in Diabetes India भी इनका awards list में है. And also काफी सारे prize winning it's called the Zorgionotti Newman Prize Chicago का for the work on diabetes and testosterone and erectile dysfunction पे भी Dr. Mithun Bhartia जी ने award win किया है. So let me welcome Dr. Mithun Bhartia, endocrinologist from Apollo Hospitals, Guwahati. Good morning, doctor.
Good morning, Jhansi, and good morning, viewers of Apollo 24/7.
Yes, a very happy morning. Each time that you bring so much of knowledge and energy to the show. So it's always fun having you on the show.
Thank you.
Thank you. And let me start with one basic question. I see that a lot of people are interested in this topic. इतने सारे registered questions हमारे पास आए हैं. The moment topic is announced, we saw a surge of viewers asking us questions even before the show has started. That means this is indicating something, doctor, कि इतने सारे लोग thyroid disorders के साथ affected है. So what is a thyroid? Where is it located? Basic question से मैं शुरू करना चाहती हूँ. And how is it affecting our health?
So, you see, thyroid इसलिए होता है कि because testing has gone up and also diagnosis has gone up because बहुत सारे packages आजकल available हैं. People do general health checkups, master health checkups. They go to the doctor for their ailments because we have started being nuclear families. So people want to protect their health from all aspects and all. So thyroid, people say मेरे को thyroid हो गया. भाई thyroid सबको है because thyroid is a butterfly shaped gland in your neck here, in the सामने वाला हिस्सा of the neck, and it has two parts, one right part, one left part. So जब आप blood test करते हो तो ऐसा कुछ नहीं पता चलता कि right side functioning है, left side functioning है. Together they release some hormones and we measure those hormones to decide whether they are in the normal range or they are in the abnormal range. Now, what does the thyroid do? Thyroid controls the metabolism, the energy level, and it regulates the whole body for everything. पहले के ज़माने में या आज भी आजकल तो बच्चे ज़्यादा यूज़ फास्ट करते हैं नेटफ्लिक्स एंड एवरीथिंग. पहले हम रिमोट फास्ट फॉरवर्ड और रिवाइंड करते थे. So fast forward phase is when your body is producing more excessive thyroid hormones. So everything is in a fast forward state. You are more angry, you are more sweating, your pulse is more, you have got diarrhea, things are running faster than out, then you are anxious, you are irritated. All the things that you do, your metabolism, your heart rate is fast, you feel dhak 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 dhak. So everything, you lose more weight because your metabolism is being done at a faster rate. So that happens when your body that your thyroid is releasing a lot of thyroid hormones which are more than normality. Similarly,
तो उसको हम हाइपर बोल सकते हैं.
उसको हम हाइपर कहते हैं. ऐसे भी हम कहते हैं ना ये तो हाइपर हो गया है, पागल हो गया है. वैसा है ना, थायराइड अगर आपका ज्यादा बना रहा है तो वो हाइपर स्टेट में चला गया है. तो इट इज जस्ट थ्रोइंग अवे मेनी हॉर्मोन्स एंड there are various reasons for that, but at this point of time to understand, First, one phase is hyperthyroidism, that is, hyper means excessive. The other phase is just the opposite, which is hypothyroidism. So, the thyroid is not, hormones are being produced less than normal. And
Okay.
this goes for all hormone systems. Whenever that is excess, we put the word hyper against it. Whenever it is low, we put the word hypo against it. Be it the adrenals. So anything that this is there, be it calcium. So hypercalcemia, hypocalcemia. So anything which is excess is hyper. When anything which is less is hypo. So what happens similarly? The body slows down. If it is hypo, that your body is reducing less hormones. When you are slowed down, what will happen? You will have constipation. You will put on weight. Your skin will become dry. You will speak very sluggishly and slowly. So everything, your reflexes will become very slow. So everything goes on the slow phase. So what we ought to do is, whenever we are looking at a patient or whenever an individual is looking at it, अभी ऐसा हो गया ना, because it is so common. I personally don't use the word disorders. It is a condition,
हाँ.
because we have to live with this condition. ठीक है ना?
Okay.
अभी जिस शादी के बाद सास ससुर के साथ रहना पड़ता है तो रहना पड़ता है ना, तो उसमें कुछ कर नहीं सकते आप। तो अगर आपको हाइपो हो गया और आपका बॉडी थायराइड हार्मोन नहीं बना रहा है, तो आपको टैबलेट खाना है, बस खत्म कहानी। तो उसमें ज़्यादा गेटिंग स्ट्रेस्ड आउट, गेटिंग अनहैप्पी कि अब मैं बंद कर दूं, कितना दिन खाऊं, कितना दिन नहीं खाऊं, द डोज में चेंज,
All right.
दैट इज।
So Soumya, Harsh and Narendra, both of them were asking the same question. जैसे आपने बोला है कि Narendra is asking, can I control without medication? And Soumya is asking, my wife has thyroid since so many years. She has had babies. She's 36-year-old. Can she be relieved from taking medicines? So once diagnosed, can I stop medication?
So if the diagnosis is correct, so I think when people talk about they're taking medicine for a long time, generally it is the hypothyroidism, which is fairly more common than the hyperthyroidism. So if we talk about hypothyroidism, if you actually are diagnosed correctly, and your body is not producing hormones, then you have to take them for the rest of your life. It's like I take my car and I put petrol in it today. अगर 1 साल 2 साल पेट्रोल डालोगे तो फिर पेट्रोल अपने आप तो नहीं आएगा गाड़ी में, रोज सुबह डालना पड़ेगा। सो वैसे ही योर बॉडी, योर थायराइड हार्मोन, द टैबलेट यू आर टेकिंग इज द पेट्रोल टू रन द इंजन ऑफ योर कार एवरी डे. So you have to take it. If you don't take it, the body will not be able to run as smoothly as you would like to it. However, the caveat here is very important. The caveat is your diagnosis correct or not? And that is why the first blood test that a person does when they're labeled to be hypothyroid or hyperthyroid is the most important test that can be done. And that should
Okay.
be interpreted most cautiously. बिकॉज अगर कोई शादीशुदा नहीं है और मांग में सिंदूर भर देते हैं तो कोई सिंदूर हटाने की हिम्मत नहीं करेगा। कोई नहीं बोलेगा अभी इसको थायराइड नहीं है, नाउ शी इज अनमैरिड। दैट इज नॉट, विल नेवर हैपन। सो दैट शुड बी डन मोस्ट कॉशियसली to label something as hypothyroidism, because once that part is done correctly, then everything goes on very smoothly. 90% of cases I see, that part is done the most incorrect. It is
Acha.
done off the shoulder.
So now you have come to the most important segment, where how do we diagnose hypo or hyperthyroidism? So ये क्या है और कैसे डायग्नोस करें? यहाँ पर मेरे पास इतने सारे लोग पूछ रहे हैं कि मेरा लेवल TSH लेवल 7.6 है, मेरा 6 है, मेरा 5.5 मेंटेन होता है, TSH is below 10 but more than 5. What is this indicating, and what I should be bothered of?
So there are three hormones. One is TSH, one is T3, and one is T4. In normal people, you should measure always all the three hormones when you are going either for diagnosis or for follow-up. This
Okay.
rule should be understood by everybody. I would not do free T3, free T4. There are exceptional circumstances to do them. On a routine basis, don't do free T3, don't do free T4. Do T3, T4, TSH. economical, and it also does the job very, very nicely. So that should be your basic parameter, which you should do every time whenever you are having a thyroid test. Don't do isolation TSH. It is meaningless, and I
अच्छा.
will tell you why. Because TSH is a hormone which is secreted by the pituitary, which is a matar ka size ka gland, which is present in your pituitary here, somewhere in between here, inside. And this is like the headmaster of your school, and thyroid is like the teacher of your school. So the headmaster will give instructions if the teacher is not performing well. In
हाँ.
generally, we say that when your body is not producing enough T3 and T4, the headmaster then increases the TSH concentration, which goes and warns and kicks the thyroid से चलो थोड़ा काम करो, तो वो अपना T3 T4 बढ़ाता है, secretion. Reverse way, if your body is producing excess hormones, that is T3 T4, headmaster उसको TSH अपना लेवल कमा देता है ताकि उधर से इधर सिग्नल आना कम हो जाए कि अभी थोड़ा शांत हो जाओ, इतना मत बनाओ, इतना आवश्यकता नहीं है. So generally,
Hmm.
in an abnormality, the T3, T4 and the TSH goes in opposite directions most of the times
Right.
when they are abnormal. When the T3, T4 is high, the TSH is low. When the TSH is high, the T3, T4 are low. There are exceptional circumstances which I think is beyond the scope of discussion for people, but that parameter should be very much understood. Now there are two
Yeah.
hormones, T3 and T4, which is more important. So both are secreted, but when it goes to the tissues, the various end organs of our body, then the T4 is converted to T3. So T3 is the active form of the hormone. However, there are, generally speaking, that is why you must see an expert doctor dealing with the hormone to understand, who can understand minutely these intricacies of the T3, T4, and the TSH. Hence, we have a doctor, what is called an endocrinologist. Trust me, before I came to medical, also, I didn't know what an endocrinologist is. So, if the audience does not know what an endocrinologist, I don't feel embarrassed and I don't feel bad also, because it is our job to tell you who is an endocrinologist. You are not going to know.
The
Unfortunately,
one who
I'm
has
still.
hormones. So so we have to visit. अगर कुछ गड़बड़ चल रहा है तो फर्स्ट लाइन तो हमारे जनरल मेडिसिन इंटरनल मेडिसिन के पास जाते हैं, बट एनी काइंड ऑफ हार्मोनल disorders, I think we have to take an expert's opinion. Apollo 24/7, we has endocrinologists. We are going to leave a link of Dr. Mithun Bhartia in the chat box as well. So yes, doctor,
So,
which is very
so
important to understand how.
yeah, because what I'm trying to say is, first diagnosis of your thyroid disorder should be done by an endocrinologist. बाकी
Okay.
अगर आपके एरिया में फॉलो अप नहीं है, आप नहीं विजिट कर सकते. Once the parameter is done, once the structure is done, what are you going to go ahead? Then if you are not been able to visit an endocrinologist, ठीक है, आप एक दो follow up medicine वाले से कर सकते हैं. लेकिन because the first parameter is so important to put you on the right track, so my suggestion would be, if you have an abnormal thyroid function test, right at the diagnosis, or you are questioning, क्या मेरे को थायराइड है, मैं इतने दिन से दवाई खा रही हूँ, मेरा TSH इधर है 6 है, मेरा 7 हो रहा है, कोई बोलेगा मेरा 5 हो रहा है, लेकिन मेरा T3 इतना है, मेरा T4 इतना है. So there are subtle intricacies that are there, because we can fight with numbers.
Correct.
5.5 या 5.6 या 5.7 में most important thing to see what is the range. Every lab has a different range. So before you say that TSH is 5, 6, 7, 8, 4, see what is in the bracket of that range. Because all labs use different reagents. That reagents the
Correct.
normality changes. तो आपके वो normal range में है या नहीं. That is most important to see first before you talk about numerical numbers.
Wonderful. So do you also suggest that there's a frequency of testing done, and continuing the same lab, or repeating or getting it tested in different labs? फर्क होता है क्या सर टेस्टिंग में?
बहुत बहुत फर्क होता है ना. तो आपने सही पूछा. देखो, अभी आपको एक नंबर, टेस्टिंग शुड ऑलवेज बी डन इन एन NABL लैब. ओके, दैट इज NABL लैब का क्या है कि दे स्पेंड सम मनी एवरी ईयर फॉर देयर क्वालिटी कंट्रोल फ्रॉम देयर पॉकेट. and that is why NABL lab will be slightly expensive. Our Apollo 27, all Apollo hospitals are NABL, and there are some others also. So, number one point, you should always test in an NABL lab. Second, you should always test in the same lab, because as I said, the ranges are different. आज आप मारुति में घूम के आ गए, कल सैंट्रो में घूम के आओगे, बोलो माइलेज अलग अलग क्यों मिल रहा है, तो बहुत मुश्किल है ना उसका जवाब देना. So you must the same, the parameter is the same, the range is the same. Now you're talking my range, normal range is say 0.5 to 5.5 in my lab, and I am getting 5.4 or I'm getting 8 now, I'm getting 9 now, then you can have a meaningful discussion with the doctor. आज इधर कल उधर ऐसे ऐसे लैब शॉपिंग करने से कुछ फायदा, आप ही का नुकसान है. यू विल एंड अप डूइंग मोर टेस्ट देन यू शुड बी डूइंग.
Right. So, and timing of the test, sir, and frequency?
So frequency, I would say, if your thyroid, we are talking about hypothyroid here because that's more common. Okay, if you are not changed the dose of the medication, suppose you are taking 75 microgram of thyroxine, and you are taking it for some days now, for some months now, then every 6 months, if nothing has changed, every 5 to 6 months is fine. If I have changed your thyroid medication, I would like a repeat test between 6 to 8 weeks. Any
Okay.
change you want to see whether when you have you fiddled the right way or the wrong way, and whether you need more fine tuning. That's why 6 to 8 weeks. If you have not fiddled, then I'll see you in 6 months. Unless you have a problem, please come early.
Right. So, yes, now that you've talked about problems, so let's understand what symptoms are. Somebody here, Naruto was 65 TSH hai, I feel fatigued and very fast heartbeat. Please help me out, sir.
तो सर ये आप देखो TSH आपका 65 है, मोस्ट लैब का रेंज होता है समवेयर बिटवीन 0.5 0.4 0.5 to 5.5 के आसपास. तो 65 है, ये तो एबनॉर्मल है. ठीक है, अभी मैंने आपको बोला कि ये हो गया हाइपोथायरॉइड बिकॉज 65 आपका ज़्यादा है. अभी आप देखो साथ में आपका T3 T4 क्या है, बिकॉज दैट नीड्स टू बी इंटरप्रेटेड विद द T3 एंड द T4. देर आर सर्टेन वेरिएशन दैट हैपन. लेकिन अगर आपका सच में हाइपोथायरॉइड है, प्योर केस ऑफ हाइपोथायरॉइड, योर हार्ट रेट विल बी स्लो, नॉट फास्ट, बिकॉज योर
Correct.
बॉडी इज अ स्लो फेज. अभी आप बोल रहे हो आपका हार्ट रेट फास्ट है, तो कुछ और लफड़ा है इधर. सो दैट्स व्हाई यू मस्ट सी अ डॉक्टर नाउ, बिकॉज कहीं ना कहीं तो लोचा है. मे बी यू गॉट सम अदर कंडीशन. In
Correct.
India, everything is blamed to the thyroid. Poor thyroid gets small organ in the gland in the neck, gets blamed for anything you do in the world. कुछ भी लफड़ा होता है वो थायराइड का गलती है. तो yes, but the other ecosystem is also important. So if you are having a TSH of 65 and a fast heart rate, there's something else going on in your body, and you need to see a doctor for that.
राइट. एंड ऑल्सो डिजिटल क्रिएटर का प्रॉब्लम ये है कि TSH 9.59 है, फ्री T3 एंड फ्री T4 और एट 3 and 1.42. सो इनका भी ऐसा ही है कि ही इज ऑल्सो नॉट. अरे क्वेश्चन तो किधर गायब हो गया. All right, sir. I'm sorry. So, when do one test the free T3 and T4? What is it important for?
So you see, free T3 and free T4, there are very odd occasions when you test. For example, see, I have got.
Okay. So sorry, इनका नाम है, sorry, वो official, sorry, the question was asked. 28-year-old है sir. T3 3 है, free T3, and T4 is 1.42, TSH is 9.59. I lose my weight and I do have IBS. Please help me.
To see, I think it would be nice if he mentions the T3, T4, the range that his lab has. If you could say, we can take up the question. If you're hearing, please send your range of your T3, 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 T4.
Sorry,
It will be
quickly
clear.
please type range of your the diagnostic lab के बाजू में आपको bracket में दिया होगा. What's the range? If you can type, we'll take your question. So we will move on to the next question. Unnati is asking if TSH is below 10, One of the doctors said it is too soon to start medications. Then, what precautions should one take to control TSH level? Because I have a TSH of 6.42, while T3 and T4 is normal. When does one start medication?
So that's a very good question, and I hope I can answer this question with a straight answer. But I am going to try to dodge the question. But I'll explain you why I'm dodging this question. See, number one, there's too much emphasis on numerical numbers.
Correct.
Okay, so I think the important factor is to see the patient and treat the patient and treat the numerical numbers, unless the numerical numbers are way off. Okay, as you have been explained, perhaps by your doctor, your T3, T4 are in normal range. These are the actual hormones. The teacher जो काम कर रहा है वो सब ठीक कर रहा है तो हेडमास्टर को इग्नोर करने का, because teacher is teaching and doing the job perfectly. So if your T3 and T4 are in normal range, then the TSH is kind of meaningless. It may suggest that the teacher पीछे पीछे चुपचाप चोरी कर रहा है, वो बाद में दिखेगा, पता चलेगा, वो बात अलग है. But as things stand, if your T3 and T4 are within normal range, you don't need medications. Now this TSH of 10, there is some odd data, but more importantly, if TSH of 10, TSH of 7, see what happens. God has created our ecosystem very beautifully. Anything goes wrong, the TSH moves up. And I think that is some kind of a protective, perhaps aging phenomena, which I don't know also in intricate details, because our body is a wonderful machinery created by God, and nobody actually knows how this was created. So how fast we are talking, how fast we are analyzing in our brain. See, what whenever something goes wrong, suppose आपका hemoglobin कम है, the TSH moves a little bit from what it is. If you see the normal range of TSH in you and me, and see the normal range of TSH between you and me after 30, 40 years when we are hopefully 70 cross, it is different. How I treat you today, I will treat somebody different with the same TSH value of 75-year-old, because that could be some protective phenomena if an isolated TSH is just rising up without T3, T4. So fundamentally, as a rough rule, people use a TSH of 10 before the eyebrows goes up to take it a little more seriously. That is the fundamental rough guidance. But for me, the answer is क्या 9.9 और 10.1 में इतना फर्क है? I don't think so. अगर आप आज ब्लड टेस्ट कराओगे अपना TSH 3 डिफरेंट NABL लैब में, तीनों में थोड़ा सा 0.5 इधर उधर आएगा. So it tells us that Jhansi is in sitting in Hyderabad. Which part of Hyderabad we don't know. Roughly we can location point we can do. It's not Google location, but roughly we get an idea what is happening with your body. But
Right.
10 is used as a rough biomarker for medicine people. They use 10 as a rough biomarker.
Hmm. ठीक है, sir. So I think you've answered Unnati's question really very well. Now, the question from Mr. Krishna Kittur. Good morning, doctor. If lymph nodes in the neck are thickened and suspected carrying cancer, what are the chances of thyroid becoming cancerous too? So, is this also something that one needs to worry?
I agree. See, very nice question. See, two things, understand what lymph nodes are. Lymph nodes are present all throughout our body. And whenever there is an infection in our body, before we pop in antibiotics to kill that infection, body has learned to take care of itself. So what happens, आपको जब सर्दी खांसी होता है तो गला में आपको थोड़ा दर्द होता है, lymph node बढ़ जाता है, because they are fighting that infection in the body. The fact that there is pain generally rules out cancer, because cancer is growth of useless tissues, proliferation of useless tissues, and generally it encounters pain only when it presses on the various structures of the body. Cancer cells by them never causes pain, only if it is pressing there, too much is there, pressing on the खाने का pipe, सांस लेने का pipe, other nerves there, then you may encounter pain. So lymph nodes enlargement and painful lymph node enlargement generally means there is some infection which is going in that part of the body which is supplied, which takes things to that lymph node. That is one thing, which means there is some infection. Thyroid cancer can happen. I mean, it can happen. Can I do something to prevent thyroid cancer? No. Have I done something that has caused the thyroid cancer? Not that I can give an advice that don't do this, you will not get thyroid cancer. How can thyroid cancer be diagnosed? Generally, thyroid cancer are diagnosed when people feel a lump, and so they go to a doctor and they feel either lump है or फिर वो ultrasound होता है. There are some suspicious features. You take a sample, look under the microscope, and diagnose it to be cancer. But that doesn't mean every thyroid cancer patient will have lump. So I might be having thyroid cancer while talking to you, but I'm not aware of it. But so much is life. So nobody can say what to do to prevent thyroid cancer. If you definitely have a lump which is painless, do get it checked out by your endocrinologist, who can advise which battery of tests needs to be done to rule that out. I can't do anything to prevent it. And do I recommend routine ultrasound for every thyroid patient to see if they have cancer? Well, you can keep doing, but whether that is going to be valuable, cause more anxiety, cause, I don't know. We don't, the jury is not out clear just to do routine ultrasounds of the neck to go searching for a thyroid cancer.
Yes. Yes, so Anush Tiwari ji is complimenting you on the comprehensive answers that you are giving, and also a lot of people are complimenting you there. Thank you so much, my dear audience, for participating so well. Well, it's up now. Anush Tiwari's question is: he has hypothyroidism and his digestive system is not working fine. He does have constipation too. Are these linked?
यस तिवारी जी, जैसे मैंने आपको बोला, अगर आपको हाइपोथायरॉयड है, दैट इज योर बॉडी इज नॉट प्रोड्यूसिंग enough T3 and T4, body goes in the slow phase and you become constipated. However, if if your thyroid is been replaced well and your thyroid levels are within the normal range and you still have constipation, then it is unrelated to the thyroid problem. It has maybe some other reason for which you should see a gastroenterologist.
Yes, yes. I think Anush Tiwari ji, you're asking for the appointment from Dr. Mithun Bhartia. We are leaving the link in the chat box where you can consult him for further doubts. So Ekta Sonamane ji is asking about what about the cases in goiter? So let's talk about goiter and the iodine deficiency thyroid disorders, doctor.
हाँ, तो goiter is anything which is popping up ना for a common public, इधर swelling आ गया, उधर swelling आ गया. See, there are certain glands. The thyroid has two parts, and then it needs iodine for secreting the hormone. Traditionally, we were iodine deficient, but nowadays, whatever salt we have, the government of India has make iodized salt. Unless you are using a lot of rock salt and non-iodized salt, most of iodine deficiency has gone up because we are using iodized salt. We can argue whether we
Yeah.
need that much iodine or not, but fundamentally, a lot of that problem has been solved by the government of India by the undertaking what they've done. So that is very, very that they have fortified, iodine in our salt as regular salt that we use on a daily basis, which is so iodine deficiency traditionally does not happen so commonly now that it used to happen. That is why. Now, when you have a goiter, what are the two things that you're worried? Goiter is what? There are certain nodules in the gland. One nodule is big, one nodule is small in each side of the gland. So there are various things, but from a common person's perspective, what you need to know? You need to know your thyroid hormone levels. That is one. Goiter is a diagnosis which will be done if you have an ultrasound. We've done an then you see you've got multinodular goiter, means various nodules are there. And sometimes the multinodular goiter will produce some excess hormone that is there. Sometimes out of these multiple nodules, one of the nodules will produce more, one of the nodules will produce less. So I'm not going to get complicated here. My point for you to understand is if you have a multinodular goiter and you're worried about it, you see an endocrinologist. Because otherwise, I'll get you more confused and a lot of scientific jargon will come out from my mouth, which neither will be beneficial to you and nor the show.
Absolutely, because this is a show where we want to bring out information and empower people rather than scare people out. So, thank you, Dr. Mithun, for giving that answer. Here's Karthik's question. Good morning, doctor. If the medication is not working or showing results for a long time, and then you have other problems as well. So, is removing whatever you call the procedure of the gland is preferable? Thyroidectomy, I think he's asking about thyroidectomy. What is it?
So, Karthik, understand one thing. Say, why do you remove the thyroid gland? Fundamentally, I don't remove the thyroid gland because I said thyroid gland has two fundamental problems: hypo and hyper. Hypo means it is not working. If it is not working, why remove the poor guy? Anyways, he's useless. Leave him alone. There's no point. Because even if you
Okay.
remove it, nothing is gonna work. Okay, so you're not gonna gain anything by removing it because you're already not working. You're already popping tablets to because that function is not done by that gland. It is there for cosmetic reason now inside your body. It's not doing the function. So why remove it? There's no fun. You don't get anything by removing it. However, there are certain conditions when the body is producing hyperthyroidism, that is, your body is producing excess thyroid hormone, and which is not regulated by medicine. Now you say, अरे बाबा ये तो दवाई से कंट्रोल में नहीं आ रहा है, अब इसको बाहर निकालो. तो फिर then you have to, then you can consider removing it on the advice of an endocrinologist.
Right. Right. So,
And
काफी
third
complicated है.
indication, and the
Yeah.
third indication is if you've got thyroid cancer, then it doesn't matter, then you have to remove.
Right. So, Karthik, keep your consultations on with an endocrinologist, and dosage is very important here. Sirisha is asking, quite a young girl, sir. Sirisha is 16-year-old, and also my daughter who was, quite young. Stress एक factor है क्या sir? इनका जो thyroid fluctuations, TSH fluctuations इतने होते हैं. Her age is 16 and she has 10, almost 9.55 to 10 के बीच में है. She takes 25 mcg of Thyronol. A solution, please.
तो एक तो क्या नाम है उनका मैडम का व्हाट्स द
Sirisha.
नेम ऑफ प्रीजा
Sirisha.
सो प्रीजा देखो मैं बहुत सिंपल सा लॉजिक बोलता हूँ 25 तो मैं जन्मा बच्चा को भी नहीं देता हूँ तो 25 मीन्स यू आर अंडर डोस्ड एकदम ब्लैंक दैट आंसर आई कैन गिव यू नाउ यू नीड मोर यू आर एट अ 16-year-old adult. You need thyroid hormone for functioning of the body, for growth of the body. If I'm going to take your car to the petrol pump, I'm going to open the nozzle, I'm going to put the pipe in it, then why just underfill the tank? Properly fill up the tank. No, give proper dose to you. So 25 suggests to me that you are underdosed. Maybe there are certain other conditions which I'm not aware in your, as a generic rule, TSH of 9 and 25 microgram thyroxine, you are underdosed. You need more thyroid hormone replacement. That I can tell you abruptly and very straight. This is not a prescription of an endocrinologist. You can
Wow.
answer this question whether this was prescribed to you by an endocrinologist or not to Jhansi while we take another question.
All right. So, Sirisha, I'm waiting for your answer there. Please do type. Dr. Mithun, while you're talking about under prescription, how do I understand कि ये right amount है? तो कितना डोसेज करेक्शन करना पड़ता है एंड पेशेंट का और डॉक्टर का जो रिलेशनशिप है जो हम लोग सोचते हैं कि एक बार बॉस मैंने डोज फाइनलाइज कर दिया कि ये लाइफ लॉन्ग डोज है. Secondly, are the same population who meet their endocrinologists or doctors are afraid of medications, doctor? They wouldn't want to continue their medications. यही लोग
Nobody.
होते हैं जो दवा पूछते हैं और यही लोग होते हैं जो दवा एस्केप भी करना चाहते हैं. So what is the importance of right dosage?
See, if you read a book Who Moved My Cheese by Ernest Spencer Johnson, you know we
Spencer
don't like
Johnson.
change. We don't like change in our body. We resist change. And मेरे साथ ऐसा नहीं हो सकता. रोज we see newspaper, रोज we watch all this news channel और bad news is happening to everybody in India. You think वैसे मेरे साथ ऐसा नहीं हो सकता. मैं perfect हूँ मेरे साथ ऐसा नहीं हो सकता. So I think number one, acceptance that you have a problem or you have a condition is important for all medical conditions and for anything that goes on in life. Because it cannot go through, we don't go through straight line in life. You know, there are a lot of numerous side tunnel road, this happens, that happens. So we go through so much in life. We eat different foods every day. We do different form of exercise every day. We have different forms of stress every day. How can you assume that the poor thyroid gland is going to function एकदम abruptly same when you are not functioning the same way 24/7 every day. So I think
Right.
that realistic picture has to be understood by everything, and that is why some dosage fluctuation. As I said, if you have another concurrent medical conditions, your dosage will change. If you take certain medications which may interfere with your thyroid, the dose may change. If you with natural aging process, your thyroid levels may change, and that is why you need to see regularly somebody who you trust on a regular basis so that you can have a meaningful discussion for the same.
राइट तो उमर साहब का क्वेश्चन अभी लेती हूँ 6-7 साल से इनका टीएसएच फ्लक्चुएशन है एंड हमेशा मेंटेनेंस करते हैं 75 mcg से वो एक ही रेंज में मेंटेन होता है आफ्टर ही स्टार्टेड हिज डोसेज तो शुड आई चेंज द डोज ऑफ थायरोक्सिन if it is maintaining well?
No, why repair a boat when it is not broken? Why repair a car when it is not broken? If everything is going on perfectly, your engine is fine, everything is going
जी
smooth, why do you want to stop and see आपने आप ठीक हो जाएगा? गाड़ी बढ़िया चल रही है, माइलेज अच्छा दे रहा है, आपका पेट्रोल जो आप डाल रहे हो रोज बढ़िया चल रही है, तो चलाओ एंजॉय करो till it lasts. Why
ओके
bother about?
सो सो इन नॉटी किड्स इनका नाम तो दिया नहीं है बट सर इनका टीएसएच अभी 0.896 पे आ चुका है T3 0.61 T4 11.73 I'm using 100 mcg from past 6 months. Does it call for a reduction in my dosage?
So what you are telling me is that the T3 is in the lower end of normality, T4 is in the upper end of normality. This is not the results of an NABL lab. Please type whether this was done in an NABL lab. Please do your blood
So I
test in an
think
NABL.
right. Naughty kids, I think you need to get your blood test done in a proper NABL accredited lab. Apollo 24/7 can help you there. Please go ahead, get yourself tested again. All right. So next is Anuradha Parthasarathy, again asking about dosage. When should the thyroxine be taken? Empty stomach or and also the blood sample. When should I give? With the dosage, without the dosage, with empty stomach or food?
So I think number one, it should be taken empty stomach and you should not eat and drink anything for at least half an hour. That rule you should apply, and then you can find your own way of taking it. A good way that I tell people who tend to forget is that you don't forget to brush your teeth. So put your thyroid tablets next to your toothbrush. पहले टैबलेट खाओ फिर ब्रश करो बिकॉज ब्रश करना आप नहीं भूलोगे. So that way you will remember, and by the time you get fresh half an hour, the tablet is done. Second is, when should I get it tested? I think you make though there are certain inter-daily fluctuations, intra-daily fluctuations, we have to be practical in life. Practicalities takes supersedes any small here and there problems that are there. So my suggestion would be that you should take it, fix up a roughly the same time. Don't bother about बिफोर और आफ्टर. आप एक पैटर्न बना दो कि भाई मैं हमेशा 11 से 12 के बीच में आई विल हैव अ टेस्ट, और 10 से 11 या 9 से 10, जो आपके लाइफ में मतलब कर सकते हो. स्ट्रेस नहीं लेने का.
Correct.
उस स्ट्रेस से भी तो थोड़ा बहुत ऊपर नीचे जाएगा ना थायराइड. ऐसे अभी आप झांसी पूछी थी स्ट्रेस से कुछ होता है, हो सकता है थोड़ा बहुत हो जाए. आई डू नॉट नो इन योर बॉडी, एवरीबडी इज डिफरेंट. So take it easy, do your test where it is convenient in an NABL lab, roughly doing the same time, roughly always do the same pattern after tablet or before tablet, so that when you are comparing the two things, all the other variables are kept aside and the doctor can interpret the difference with caution.
Yeah. So here's Deepika. Deepika has migraine and back headache. So is there a major relationship between thyroid and migraine? Also, she has continuous chest pain. Her TSH details कुछ दिया नहीं है sir.
अच्छा दीपिका, देखो मैं जब इंग्लैंड में था ना तो हमको एक चीज सिखाया गया था कि कुछ भी कभी भी हो सकता है, तो ना नहीं बोलने का. ठीक है. So everything is possible under the sun. We talk about the likelihood of that happening is different, the percentage. Now the only logical sign that moves with you is in a hyperthyroid state, Where the heartbeat is beating thub 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 thub, you will get chest pain. Whether everything is on the hyper mode, you may get some exacerbation of migraine. That would be the only correlation that we can have, other than certain rare conditions of thyroid, which I will not discuss today. Or you may have a thyroid problem and coexisting something else which is causing it. It may be a condition which matches both the migraine and the palpitation, which could be stress related, or a medical condition which is causing it. So see your doctor for that.
Wonderful. So here are a few questions about surgery and other hormone-related issues. I think these are slightly more serious questions where I'm not sure if we can answer all of them here on this platform. Please feel free to take them for a later consultation. The first one is about pituitary adenoma. So, what should be the dose and what are the values to be checked for replacement for pituitary adenoma?
So for others, let's understand what did I say. Pituitary is a pea-sized gland here. This is the headmaster. The headmaster doesn't have one teacher in the school. There are many teachers in the school, right? So thyroid is one teacher, adrenal is one teacher, your reproductive organs are one teacher. So there are so many teachers in the school. So this poor guy controls everything. So if you have a problem in the pituitary, then you have to check all the teachers whether they are doing the job or not, and you have to then interpret their hormones, give or take the hormones based on the results.
Right.
I
So,
hope that
pituitary
answers.
adenoma, yeah.
Pituitary adenoma, so I think it gets very technical for everybody. So I think what I would say is that the only thing that you have to understand, the rule for pituitary, like I said, for hyper and hypo TSH one side, T3 T4 the other side, that rule doesn't apply when the problem is at the pituitary. That rule applies when the problem is at the here the teacher is not working. When the headmaster is not working, the whole rule changes.
Okay, that's a different case. So today we will not discuss about that here.
Yeah,
So
because
for
it's
a
too
later
small.
date. Yeah.
But it
Right.
doesn't generally go in opposite directions. It has a lot of intermingling that happens because for the boss the rules do not apply. For the workers the rule
Correct.
applies.
Okay, sir. Here's Priya's question, 39-year-old female. So thyroidectomy patient hai, and will the dosage of thyroxine intake keep increasing over my lifetime? Also, why can't hypocalcemia be avoided by pre-administration of vitamin D or calcium before thyroidectomy surgery?
So very good question. So I think there are two questions. By the sounds of it, you have had a thyroidectomy. Okay.
Mm.
Now, what is parathyroid or calcium regulation? The thyroid is a butterfly shaped, and the edges of all the four parts there are small glands which are called the parathyroid glands. There are four parathyroid glands, and they regulate the calcium of our body. So when the poor surgeon is taking your thyroid away, it is a big possibility because they're so small that they may take away the parathyroid glands also. If they take away the parathyroid glands also, your calcium is going to be low after the surgery. So, in generic, if you are having a thyroidectomy or a parathyroidectomy, if there are problems with the parathyroid, your vitamin D should be replaced first before the surgery so that this question doesn't apply what she is asking.
Mm.
Beyond that, it's more complicated, Priya. You see an endocrinologist for that.
All right, thank you, sir. Next question is Tilak Das, who's asking for Nandita, 68-year-old. The endocrinologist has suggested an anti-TPO test done, and the result is 335. What does that mean? And also continuation, sir. Vishnu Venugopal, will you please suggest any diet for an autoimmune hypothyroidism?
So, two things I will ask the first person who asked the TPO to
Tilak
398.
Das.
तिलक जी आप पहले लिखिए तो सही कि आपके डॉक्टर ने क्या बोला तो मैं उसको फिर आपको I can actually explain that in a proper manner. I'm sure you have shown the result. Just type that briefly. I'll take the other question. I'll come back to that question. If you don't type, I'll
Sure.
still give you an answer. In terms of a diet, there is no diet. Okay, because they say people with hypothyroid you should not take cabbage, cauliflower, soya because they're goitogenic, they may increase sweating. This is fine. I've hardly come across somebody who loves cabbage so much that they have it on a daily basis. Okay, nobody has cabbage on a daily basis. Nobody has cauliflower on a daily basis. Okay, so if you're having
Sure.
something on,
Sure. Let
huh,
me correct
let
you.
me
Let
answer.
me correct
Let me
you,
answer.
Tom.
Let me finish the answer. Then you come to that, Jhansi. If you are taking it on a daily basis, then please avoid it. This is the point I'm trying
Ha.
to say. If
So the
you're
newer
taking it
the
on a
diet
daily
are
basis,
promoting left, right, center cabbage and cauliflower, the keto diets, the all these weight loss
that's not.
diets. They have cabbage soup and cauliflower rice.
So, well, we can have a huge discussion on this so-called diet masters and what they do in life, and that is why I'm sure you will have a lot of questions on my weight is not coming down. Still, I'm doing this diet. I'm still overweight. My thyroid is to be blamed. So we can take that question if you have time. But the point is, if you're having all this on a daily basis and on a regular quantity, then please avoid them. If you are hypothyroid, more importantly is something soya milk, because soya milk is milk. You'll drink the milk, so you'll have it on a daily basis. Whereas to have cauliflower and cabbage, you may have it once in 2 3 weeks. Chalega na baba. Right? You, if you like it, don't deprive yourself. If you don't like it, then there's no justification in discussing it.
Hmm. ठीक है. So Tilakdas ji, that's not the answer that Dr. Saab was looking at. Dr. Saab was asking कि आपके जो evaluate कर रहे थे डॉक्टर,
उन्होंने क्या बोला?
उन्होंने टीपीओ एंटीबॉडी टीपीओ रेंज के बारे में क्या सलाह दिया आपको? So he just texted that उनका TSH is 9.5.
Okay, so let me answer that. So TPO
Yeah.
antibodies, I am not a fan of TPO antibodies. I don't do TPO antibodies as a generic rule. Okay. इनफैक्ट माई लैब ऑल्सो कॉल्ड मी, भाई आप कर क्यों नहीं रहे हो, सब तो कर रहे हैं. मैंने कहा भाई आई कैन नॉट सी द जस्टिफिकेशन. आई यू डू अ टेस्ट एज अ डॉक्टर इफ इट चेंजेस द प्रिस्क्रिप्शन ऑफ योर पेन. If I am going to give you 75 microgram of thyroxine, whether your TPO is 300 or 400 or 500 or 1000 or 20, it will not change. So I am not a fan of doing it on a daily basis. That is why I was asking, what did your doctor say? The answer, I wanted to know what they said. And there is no correlation that आपका TSH 300 है, अरे बापा डर जाओ, आपका 200 है तो थोड़ा कम डरो, या आपका 50 है तो और कम डरो. That correlation doesn't exist. What the TPO antibodies say is that it is an autoimmune form of thyroiditis. Fine. Does that change my management? 99% of the time, they don't. There are very rare conditions which is done. As I said, in the whole year, I don't do more than, I see so many patients, not more than 30 TPO antibodies in say thousands and thousands of prescriptions that I do for testing in a year. So it's a very rare test, and it has should be done when it changes your prescription for something else.
Yeah, I'm
Otherwise,
here for you. I am diagnosed with an autoimmune thyroiditis. My nodule, my I have nodular, and I've been monitoring it. Once my endocrinologist has suggested that I do an antibodies TPO, that doesn't matter. As long as I am healthy, fit, I don't have any other symptoms. I'm working
don't
out. I'm
do
eating well, sleeping well.
don't do your TPO antibodies.
Yeah.
Yeah, and if your endocrinologist says that kar lo, to you can ask them to call me if they want to talk to me. Feel free to quote me.
Yes, sir. So, yes, almost towards the end of the show. So, I just have a few more minutes left and I have a lot of questions there. So, weight and thyroid, a lot of questions that our registered users also have asked for. Obesity and low metabolism, and not able to lose weight even if the thyroid tablet is taken. Why is it so?
I don't know. Is the honest answer. Because anything you do, you I see you have a perfect perception of your body, and there is the body is a very try to maintain itself in its same ecosystem. It doesn't like change. Always understand, your body doesn't like change. Now, if you are, that is why when you all do this very nice diets for 5 days, 6 days, thika, you will lose some kilograms, but then the body rebounds back, because we have a temperature regulator of our body. See, everybody's body temperature is roughly fixed for that person. Your body, some people are a little cold, some people are a little warm to touch, but they have their own thermostat building in their body. Similarly, they have a similar function in which a thermostat exists for their weight, and that is set at that point of weight. Say suppose my it is set at 80 kilograms of mine. जो जबरदस्ती करूंगा तो नहीं होगा. You have to trick the body and try to manipulate the weight. But what we see, because we know through the media, through various meetings, through everywhere, that hypothyroidism causes weight gain. First thing the person does when he's concerned about the weight is does his thyroid test, which is not wrong because this is a reversible condition. And then if he does not lose his desired amount of weight, he says कुछ तो लफड़ा है मेरे thyroid में. अगर आपका thyroid hormone is abnormal and it has been replaced and still you are putting on weight, it is not the fault of the poor thyroid. Please leave them alone. There are other reasons for you are gaining weight that has to be explored, that has to be treated, and there are certain hormone conditions also. There are certain non-hormonal conditions also, and that has to be found out so that we can focus on the on the right path. If you're going to bark down the wrong tree, you're not going to achieve anything. So put your energies to gain what you have to achieve.
Right, sir. So next question is about Chandrasekhar Ramaswamy's question. Good morning, doctor. Would hypothyroidism affect women with their menstrual cycle and also prevent women from getting pregnant?
Very good question, and the answer to both in the interest of time is yes. Uh, yes, if you have a normal thyroid function test, as thyroid regulates everything, it regulates the menstrual cycle also. So hypo and hyperthyroidism will cause abnormalities, and also it can affect the pregnancy that is there. So, and the pregnancy levels are different to normal variations of blood test. जो आपका range हमने बताया, आपका range अगर lab देता है तो they are not giving you pregnant range values. So that their pregnant range values are different and normal person's ranges are different. That has to be interpreted. But the answer to both of them is yes. It can
Okay.
affect.
Right, sir. Srinivas is asking important question. Thyroid and vitamin D का correlation क्या है? Age is 42, TSH is 6.2, but I'm losing weight from last 3 years. Is TSH only the deciding factor? Please clarify.
So we have discussed that TSH is not the deciding factor. You need to see your T3, T4. You are losing weight. If you are losing weight because you want to
So
lose weight,
T3 T4 भी मेरे पास है sir. T3 94.5, T4 is 8.5.
so it sounds like the T3, T4 are high and the TSH is
6.2.
abnormally normal. So you need to see a hormone specialist for that. The first question, we had two questions. What was the first question, Chasi?
Vitamin D sir. Vitamin D
So
के साथ relation.
for your vitamin D, we can have a full 1 hour seminar. But the bottom line is everybody has tried to find something to do with vitamin D. अरे इसके साथ मिला दो, हार्ट अटैक के साथ मिला दो, स्ट्रोक के साथ मिला दो, थायराइड के साथ मिला दो. But the poor guy has not found a house so far. He's still trying, a homeless guy trying to find a house. We don't. We have not found a pure cause and effect relationship of vitamin D with thyroid.
Yeah, yeah. All right, sir. Sir, quick cholesterol and thyroid disorder के बारे में बताइए शंकर भट्टाचार्य.
Hypothyroidism can increase your cholesterol profile. So if you replace your thyroid hormone well, your cholesterol profile can become normal in absence of cholesterol lowering medication.
All right. So Tilak Das ji has talked about endocrinologist in Apollo Clinic only करके लिखा है, but I think you answered his question already there. So one quick thing, can you also have other metabolic disorders associated with once thyroid is not functioning well? So what are the other parameters that one needs to be aware of and watchful of?
See, very important thing, no. You see, in a house, all the sisters work together. If you have an autoimmune condition that the body attacks itself, all other autoimmune conditions can exist in your body, like diabetes, like adrenal problems, like thyroid problems. So all the sisters, like you've got whitish pigmentation, which is called vitiligo of the skin. So all in pernicious anemia, your B12 level may go down, and you may be anemic. All these sisters may work together if you have one autoimmune condition. So if you have one autoimmune condition, your chances of increasing the other autoimmune conditions increases.
All right. So, yes, I think due to paucity of time, I'll not be able to take most of the questions there, but you have answered really very well, sir. So, I will have to wind up for today. But before we leave, we want you to give me top tips, give us top tips to manage thyroid disorders.
Okay. So my top tip for managing thyroid disorders is get your diagnosis correct first. You start wrong, you go down the wrong channel. So get your endocrinologist when you're diagnosed to check whether your diagnosis is correct, and stick with the same doctor who you trust, stick with the same NABL lab that you trust, test at the same time always, so that interpretation of the results is more meaningful.
Right. So those were very, very quick top tips. So Dr. Mithun Bhartia, thank you so much. As always, the moment you come, you lighten up everything, and then हमारी जो serious बातें हैं, उनको हमारे सर से बोझ उठा देते हो आप. Thank you once again for bringing in the personality here.
Thank you. Thank you. Have a nice day.
Thank you so much, Dr. Mithun Bhartia. And now I'm going ahead to conduct a health quiz. I'm going to ask you 3 questions, and you'll have to answer the questions only on YouTube chat. 3 winners will be picked towards the end of the show, and winners will be selected at the sole discretion of Apollo 24/7 team. If I take your name to be the winner, and you have to write back to us with all your name, contact details, phone number, address, etc. to marketing at apollo247.com before Wednesday of every week. So gift vouchers will be shared with you. There are people who have not received their prizes earlier. We shall definitely take it up forward to the marketing team. And here are the 3 questions for this week on your screen. The first question is fill in the blanks. There are blank, how many types of thyroid disorders? क्वेश्चन में एक फिगर डाल दीजिए ब्लैंक में. हाउ मेनी टाइप्स ऑफ थायराइड डिसऑर्डर्स? Question number 2, true or false? Hypothyroidism is a condition when the thyroid gland makes more thyroid hormone than the body needs. True or false? Hypothyroidism is a condition where the thyroid gland makes more thyroid hormone than the body needs. Question number 3, yes or no, thyroid problems can also lead to irregular periods. Question number 3, yes or no, thyroid problems can also lead to irregular periods. So these are the 3 questions. Please answer them on the YouTube chat. I see our regulars are participating. I'm happy to see a few of the regulars here, and I would also want the other viewers to participate too. In the meanwhile, while you type your answers, let me give you the coupons that you can use on Apollo 24/7. Consult top doctors direct from Apollo, and you get a 150 rupees cashback on online doctor consultation when you use the code AskDoc150, and you can use this on Apollo 24/7. The next one that we are giving you is order medicines direct from Apollo. Get 25% off when you order medicines online. The code to use is FIRST3, FIRST3, and you also get a 2-hour delivery when you order with Apollo 24/7. The next one is exclusively for our Health Hour viewers. You use this code, you get up to 199 off on online consultation with Apollo doctors and 20% off on medicine orders. HH247. This is the code. In addition to the other two, you can use this. This is exclusively for our Health Hour viewers. HH247. Write down the code. The next one is, oh, by the way, let me tell you that our Apollo 24/7 is also available on WhatsApp. If you're looking for medicines, they're just a call away. You can call or text on WhatsApp 9355247247. That's the number you got to save on your mobile number, and just text what you want. That's it. And this week we have talked about thyroid disorders, and like most of you have been asking कि weight management काफी difficult हो रहा है thyroid disorder के साथ. But let's understand what you can do to manage your weight. So we are talking about best diets for weight loss, what works, what doesn't work. All about diet and weight loss, 21st July, 11 a.m. Don't miss this session. If you are struggling with any of the metabolic disorder, if you have weight to be reduced, this is your chance to join us and get the right advice from the right expert. Today's winners are here. I'm announcing the names. Here are the winners. Congratulations. Krishna Narayan, Lavanya CNM, Unnati Srivatsa. I repeat the names: Krishna Narayan, Lavanya CNM, Unnati Srivatsa. So these are the winners for today. Please write back with your contact details at Apollo24 marketing at apollo247.com. Thank you all of you for joining and making this session so interesting. Thank you once again. Namaskar.